who are obese. They all are risk factors for the stroke because they all are risk factors for the metabolic syndrome, and the metabolic syndrome will cause narrowing of the arteries or cause high blood pressure. So they are all interlinked, these risk factors, if you can see. So everyone has got an independent sort of linkage to the increased tendency to stroke. But when these risk factors get together, patients have a higher risk of developing a stroke. And often they are seen to be present together because they're interlinked. So what does a stroke look like? Interesting. I'm not sure that you have ever seen a patient of a stroke, or maybe you've seen a video of a patient of a stroke, maybe in an ad or in a TV drama. Probably have seen. So there's a sudden onset of weakness or numbness on any side of the body. So that's a rapid assessment of a suspected stroke. We will come to it in a minute. Sorry. Okay. So numbness or weakness on one or both sides of the body. Patient can feel dizzy because of the weakness. They can't walk. They got problems in speaking. They can have visual problems. They can become unresponsive or have seizures. So one thing is clear, it's an acute. There's no chronic stroke. It's an acute onset of symptoms which comprises of a weakness or numbness of one or both sides of the body, dizziness, difficulty walking or difficulty talking. Could have visual problems depending on which part of the brain is affected, which part of the cranial nerves are affected, and depending upon how big the area involvement is and how much is the rise in the intracerebral pressure. Patient can be unresponsive or can have seizures. So that's a Rosio scales. You use this for a sort of a probability of the stroke in acute presentations. So let's go through this one by one. So it's for a rapid assessment. So as it says, it has got numbers. Some are minus or some are in plus. So total is from -2 to 6. So any score of greater than 0 indicates the stroke is a possible cause. So it's all about the weakness, unilateral leg weakness, arm weakness, grip, speech loss, visual field defects. They all have +1. Look at the -1 the loss of consciousness or seizures. These are not the usual presentations of the stroke. So you must do the exclusion of the hypoglycemia. So you check comprehensions. So there will be a receptive dysphasia and a nominal dysphasia. Check articulation for dysarthria. So the patients can have a dysphasia, but that can be a receptive dysphasia, so which can be checked by comprehension by giving some commands to the patient, and they can't do it. That's a receptive dysphasia. So you ask the patient to name people to identify, it's a nominal dysphasia. Motor deficits. Check for pronator drift. So ask the patient to hold out arms and maintain their positions. A pronator drift will give you subtle signs of pyramidal signs. So see opposite. Check for clumsiness of the fine finger movements. These are subtle pyramidal signs. And you check sensory and visual inattention. Sensations and visual fields. And check truncal ataxia if the patient can sit up. So that's a rapid assessment. So again, let's discuss about the symptoms. So trouble speaking and understanding what others are saying. That's number one. Paralysis or numb arm or leg. So a patient may present with sensory predominance or motor predominant symptoms or mix. Can have problems in both eye, in visual problems or in one eye. Could have headache with raised intracranial pressure because of the difficulty in walking, because of weakness. So these are some symptoms and signs. So let's go one by one. So trouble speaking means dysarthria. Patient could be slightly confused because they not understand what you're saying. They can have receptive dysphasia or nominal dysphasia. Patient can have a weakness on one side of the body and subsequently the patient have trouble walking. Patient may develop numbness on one side of the body. Weakness could be anywhere. Patient may not maintain the balance. Difficult to understand. Patient could have visual changes or dizziness. So these are the main symptoms. And to be honest, the neurology revolves around these 10 to 12 symptoms. If you read the differential diagnosis of each of these symptoms, you probably would be able to handle the neurology better. So that's the take-home message actually, that these are the 10 symptoms and signs which patients may present with when you had a high suspicion of a stroke, which warrants investigations. So how do you know if it's a stroke? What you will do? So there is something which is called as FAST. It's an acronym. It means act fast. Jaldi kare. F stands for face. So patients ask the patient to smile. They may have a drooping of their lips, or drooping of the face to one side, angle of mouth will disappear. Patients can ask the patient to raise their arms. A stand for the arm. Speech, ask the patient to speech, dysarthria or aphasia. Or second is T, is time is the key. So call ambulance immediately. Take the patient to hospital if there are above symptoms or any of the above symptoms. You have to act fast. So again, FAST stands for F stands for face, A arm, A speech, T time. Why people do not seek treatment? That's important thing. But what are the main reasons people don't get to the hospital on time? A is they're not aware of the symptoms. They have no idea what does this mean, how dangerous it could be, how soon you need to take the patient to the hospital, how much urgency it carries, because it carries high mortality as well. So denial, you say no, it's not stroke, just in a denial phase. Or you say nothing can be done, it's happened, फॉलेज हो गया अब ये 6 महीने बाद ही ठीक होगा. And sometimes people say, oh, अब अस्पताल लेके जाएंगे, पैसे लगेंगे, they worry about the cost. Or they think the symptom will go away, wait for another day or so. They had some fears. They don't trust hospitals. So most of the time is they don't recognize the symptoms. That is the most important cause, but not going to the hospital for these symptoms which could be lead to a dangerous neurological emergency. So if you see these symptoms, so it's again be fast, it's a bit more elaborate. So B stand for balance. So balance, they can't keep their balance, they feel dizzy, there's sudden loss of balance or sudden loss of coordination. Eyes, if they experience any sudden blurred vision or double vision, or they can't see, the face droops on one side, if the patient doesn't raise one arm or cannot hold one arm up, if they don't talk normal, it's all like they are drunk, so slurred speech, you can't understand what they're trying to say, it's the time to call the ambulance. So I think this is a more comprehensive type of symptoms slide. So be fast. Balance, eyes, face drooping, arm weakness, speech difficulty, and time to call 911. Oh, I hope you are getting me so far. So just go behind. So these were the main symptoms which we discussed. So severe headache, slurred speech, difficult speech, confused, weakness, sensory loss, cannot walk, can't maintain the balance, dizziness, difficulty understanding, changes in the vision, or visual problems. So a little bit about, I'm sure you're going to get through this in details in further lectures, but a little bit about how do you survive it. So it depends upon the location of the injury or extent of the injury or the area of the brain. So if you get to the hospital within 6 hours of symptoms, there is a chance that may reduce a permanent deficits if it is treated. So first 6 hours, so that's why the time is very important. So in FAST or be fast, the T stands for the time. Again, this is another slide. Right, what can I do to prevent the stroke? That's important. That's important. So manage the risk factors. So risk factors are hypertension. Best manage your hypertension. You've got a high cholesterol. You've got a heart problems. Get those pharmacological therapies for these conditions and get them under control. Regular exercise or health. Quit smoking. Diabetes management is very important. And be aware of medications that increase your risk of clots. There are some medications that increase the risk of clots as well. So 10% of the stroke victims recover almost completely, 25% continues to have minor impairments. 40%, so only 10% recover completely. That's pretty bad. So around 60% and 65%, they will have impairments, either minor or severe. Mortality is around 15%, and 10% remains in the long-term care. So they remain dependent. So I think this is one of the last slides probably. So how do you manage it? So I'm sure you're going to discuss this in detail about the management, but these are the things, key things, which you will do while managing the stroke in patients who came with those symptoms which we have learned just before. So airway, you make sure the airway is open, it's right, so breathing is fine, there is no blood pressure problems, hydration status, nutritional status, medications, and blood pressure. These are very important bits. So you monitor the blood glucose. You monitor closely to avoid hypoglycemia. If pyrexic, investigate and treat underlying cause. Pressure areas, because they lie with long hours, they are immobile, they tend to develop skin infections, and pressure areas are very important to monitor. They could get incontinence. Early mobilization is the key. Otherwise, they develop as stiffness, strictures, and which cause further immobilization. So that's all regarding symptoms of the stroke and how does the stroke can present. I'm going to give you a couple of minutes to share your thoughts and ask questions if any. खत्म हो गया लेक्चर खत्म हो गया बस तूने 2 मिनट दे सवाल करे भी बंद कर दे क्लास हाँ ओके थैंक यू